Okay, in this video I'm going to show you a special massage technique that you can do yourself that is good for treating chronic repetitive strain injuries to your upper extremities, primarily your wrist and elbow. Now, repetitive strain injuries, or RSIs, are painful conditions that are caused by overuse of a particular muscle group. And this would include activities like frequent typing, especially if your workstation is not ergonomically set up. It could be like data entry, it could be like assembly line work, or any kind of activity that involves the continuous contraction in the same pattern of a particular muscle group. Now, what you'll need for this self-help therapy is like a massage tool. I use this. It's called a Massage Star, and you could get it in an online massage supply store. And a topical emollient that's also has some pain-relieving qualities. This particular one's called Sombra, and its main ingredients that are used to relieve pain are camphor and menthol, which are pretty much non-reactive and they're pretty safe to use. Okay, and what you'll be doing is stripping the muscle where it attaches to the bone. That's where most of the pain is. Epicondylitis is one form of repetitive strain injury where the tendinous attachments of the muscles that cause the wrist to flex upwards and the fingers to straighten inserts into the side of the elbow. And with overuse type conditions or situations, it can develop inflammation there. And micro tears can happen to the muscles whenever there's injury, whether it's major trauma or micro tears. The body does attempt to rebuild it, and it does so with scar tissue. Scar tissue can develop adhesions, which basically is like glue that causes certain parts of the muscle to stick together, and it causes muscle dysfunction, and after a while trigger points develop, which are very focal, painful, and tender points along the muscle. So I'm going to show you what it looks like. It's pretty simple to do, and the things that it does is it strips the adhesion, kind of uses mechanical force to break it apart, while at the same time hyperfusing it with oxygen-rich blood, and oxygen is what's needed for proper tissue repair. So those are the two things this self-help therapy accomplishes. Just do it as needed. If it causes an increase in your pain, your condition is probably acute, not chronic, and you want to hold off on that and apply ice and wait until it becomes less acute, subacute, and you could attempt to do this. And over time it will help improve range of motion to your joint, and it'll reduce the trigger points and reduce the pain. Obviously, like in anything else, if you don't see results or if the condition gets worse, immediately stop and see your doctor. Okay, so here we have the elbow, and once again this is the lateral epicondyle, this is the medial epicondyle, and we're going to work on this. You can feel the radial bone here, the bump that you feel here, and this is the tendinous attachments to the muscle that causes the wrist to extend and the fingers to straighten out. As a matter of fact, tennis elbow is actually lateral epicondylitis, because some tennis players that do the backswing, when the ball makes contact, it causes a very quick contraction of the muscle, and it pulls on the lateral epicondyle here, and over time you can develop pain and inflammation. So again, this exercise, or this therapy, is for the chronic stage, i.e. when it's not swelling, there's no heat or redness. It's reached a chronic stage where it's just mostly pain from old scar tissue and adhesions. We're going to apply the Sombra over the elbow and surrounding areas. I like to get the deltoid fascia as well. Sorry, the triceps fascia. We'll start out with the flat edge, and just simply strip the muscle like this. And if there's scar tissue there, you're going to feel some vibration in your hand because it'll run over some bumps in the tendon. That's what the scar tissue feels like. You'll feel a little bit of vibration there, and that's when you know that you're hitting some scar tissue adhesions. Okay, you see it turning a little bit red there already. So it brings oxygen to the area, which is good for healing. And to enhance it, you could have the wrist go up like this. Just tell the patient to move the wrist up in a slow pattern like this. Okay, go ahead. Yeah, like that, and just... it brings the muscle closer to the surface too. And I'm applying some downward pressure, but not a lot. Okay, relax. And then the nice thing about the massage star is that it has these eccentric notches here that can be used for tendons and smaller body parts. It's got a trigger point application that you could work the trigger points out with, and a broader one if the trigger points are too painful. So we'll use the notch to get a little bit deeper in there. Okay. Get a little bit of the triceps fascia attachment here. And you could also do cross fiber massage with the tip. Okay, like this. Alright, and again, just to illustrate the notch here, if you want to do the wrist, just take the notch and work it like this. You can get the thumb, the thenar pad, and you can get, fingers, the intrinsic muscles as well. So this works really well. And for trigger point work, you just apply pressure down like this. Okay, just for a few seconds, hold it down. Alright. Okay, so that's basically it. That's how you use the massage star, and it works pretty well. Again, the disclaimer is if you're feeling extra pain, just stop and give it some time before you attempt it again.